Welcome back to the Dental Deep Dive. I'm your host, Yvette. In our last episode, we talked about the different types of dental insurance plans. The HMO, the DHMO, the PPO, and that in-office plan. But today, we're getting real. I have a special guest, someone who's in the trenches every day at the front desk, helping you with your dental insurance. So please, help me welcome to the screen, Miss Cece. I like to call her Front Desk Diva. Before we get started today, please hit that subscribe button, and if you enjoyed the information, give me a thumbs up. Hello, Miss Cece. Thank
Hi,
you.
how are you?
I'm doing well. Thank you so much for joining me today and sharing your precious time to help me educate the world about dental insurance.
For sure, anytime.
As you know, since you sit at that front desk all the time,
Yes,
you have to deal with a lot.
yes, yes.
So we're just going to dive right in. Let's see. So my first question today is going to be about a brand new insurance plan. I have to read all this stuff because I didn't get a chance to memorize all these questions. So it says, if I'm brand new to dental insurance, what's the first thing I should look for in my plan?
The first thing you should look for in a plan is how often do you need to go to the dentist and how much work do you need to have done? Um, I tell people this all the time because they always ask me, what is the difference in what insurance is the best insurance? It depends on how much work you need. If you need a lot of work, I recommend an HMO. Okay.
Okay.
Why? Because with an HMO, you do not max out. Now,
Oh,
when you get into getting a PPO, you have a certain amount for the year. So once you've reached that maximum, let's say you have a root canal done. Most times, having something like that done will take the majority of your maximum for the year. So that means if it's January, you have a root canal, come June, you won't have any more benefits, so you're going to be paying out of pocket. So if that is a choice, I would choose to go with the HMO because you know you can never max out. Now, you're always going to have an out of pocket with whichever you're going to choose. You have
okay.
a deductible with the PPO, okay? With the HMOs, you have an office copay every time you come. So it just all depends. Now, when you're looking into getting, say, a PPO, you need to ask these certain questions. Is there a missing tooth clause? Is there a
Right.
waiting period? And those are the most important questions that you need to ask. Those are the important questions because when you get an insurance, you don't want to have to wait if you need to have work done. And if you have a tooth
Exactly.
that was already missing prior to you having the insurance, they won't cover it. So these are the questions you
Wow.
need to ask when you get this insurance.
See, most people wouldn't even know that. I mean, who would? I mean, if you, my biggest thing is most people think that health insurance is the same as dental insurance, and it's not. Because I
Hmm.
mean, that if you need to have open heart surgery, they're not going to say, "Oh, there's a waiting period for us to serve."
Exactly.
So
Exactly.
nobody knows what this waiting period is supposed to be about. Um,
Hmm.
but you mentioned, I'm going to take us back a little bit. Maximum. So, can you give us an example of what a maximum is? Like,
Okay.
what's involved with a maximum?
For sure. So, like with a PPO insurance or an indemnity plan, you have usually it goes up to 2,500. Now there are plans where you can get $5,000 maximum for the year, but
Mm,
usually those are like the Medicare plans that they offer. Okay, so usually someone working for an employer and they have a choice to choose the PPO, most likely the maximum would be 25. So it ranges. Plans start from 1,000 to 2,500, and that's
hmm.
basically how that goes
Okay.
when it comes to
And
max.
okay, and let's I'm going to ask about benefits because most people think I have to pay. Do I have to pay? So I have a new plan. I know
Okay.
I'm going to get 2 free cleanings.
Mhm.
Okay, so I come in for that year. It's a brand new year. It's January. Say it's January, and I'm starting off fresh. I want to, get all fresh up with my teeth. So I want to come in for a cleaning. So you do that cleaning. Do I have a copay at that cleaning?
Well, it depends. Why? Because if you come in and you see the doctor, they do x-rays and they see that you have more involved than just the prophylaxis cleaning, then you're looking at a copay. Most of the time, it's 80% that they would cover, and you would pay 20% plus your deductible. Now,
Right.
if you're someone that's been going to the dentist every 6 months, like you're supposed to, you follow up, you do your cleanings, you're flossing, and you go in for the first time, you may have a deductible that might apply. So you might have a $50 deductible. It depends on the deductible that you might have at that time.
Okay, because from my understanding, what I used to do at my office was it's the beginning of the year, and if you came in for your cleaning, normally, the new year, most people have a $50 deductible, and if it's a family, $100 deductible. If it's
Hmm.
it's a family, but that's only if they had something done. So, like you just said, I go in for my cleaning, and she says, "Oh, by the way, you have a little cavity starting to appear. Let's get it right now." So then you go in and you do your filling, and then you walk on. She goes, "That's going to be $50 deductible plus, I mean, your
Whatever your
$50
out of pocket.
copay
Hmm.
plus whatever." And then they're like, "Well, wait a minute, I shouldn't have to pay." But yeah, it's the beginning of a new year. So most people don't realize the beginning of a new year, there's always a deductible, and it doesn't go to the office.
No.
It goes to the insurance company, and
Insurance
most people
company.
don't realize that. They're thinking you're just taking their $50 and pocketing it.
Yes, no, that is how the insurance will not pay. They will deduct that $50 because they're taking away from your benefits of what they're going to pay. So that is automatic.
Okay. So and see, this is so good. That's so I'm so happy I have you on here because while we're talking, I'm thinking of new questions to add on to this here. Now we just talked about where was I getting ready to go with this? Um, Coming in and having that waiting period. Most people understand that I've been paying. If I just started my insurance, because someone asked me this yesterday, that's why I wanted to bring this up. Someone believed that the reason why there's a waiting period because they need you to pay into the plan before they start paying for all this big, I'm going to say office item that you might have to
Hmm.
have done. So is
Hmm.
is that the reason why there's a waiting period, or
No,
do
that's
you
the
understand it to be
stipulation.
something
That's
else?
the plan that they chose. That's why I said you got to make sure you ask these questions when you get a plan, because anybody, that's just like if you go and you want to buy something, you're going to do your research. You're going to ask the questions, you're going to look into it. Okay, is there a waiting period? I'm getting this plan. I need to have my dental work done. When you get a plan, you need to ask these questions. Right away, is my benefits going to start if I get a PPO 180, 50? So you have to ask those questions because a lot of times, if you get like an individual policy, there is going to be a waiting period most of the
Right.
time. Now, if you're with an employer, there's not a waiting period. It depends, like I say, on the plan that you pick, what you choose, how much you're willing to pay monthly for that plan.
That's good to know. That's good to know. So now let me ask this next question here. Let me see what I have coming up next. Okay. So I always hear about PPO and HMOs, and we already went over that. What's the real difference? What's like the real? I mean,
The
because
real
most people,
the real
yeah,
difference is with the PPO, yes, it's gonna be less that you're going to pay, right? But you're gonna use the majority of your insurance. Like say for a crown. If you need a crown on a PPO insurance, you're looking at probably about $450. Why? Because the insurance is going to pay towards that.
that's 450 out of your pocket.
Yeah, 450,
Okay.
like say that's what your out of pocket would be, and then plus your deductible. So let's say $500. Okay.
Okay.
Versus the HMO, a lot of times crowns on a molar tooth is not covered. And most people a lot of times need a crown on the molar. So the insurance,
Absolutely.
yeah, the insurance company, they don't want to pay for that. So what they do is they make you pay out of pocket a discounted rate. So with a molar, you have to take into account they would prefer for you to have like an amalgam filling or a silver stainless steel crown, but we don't do that anymore.
Absolutely. Absolutely. And that's one thing that most people don't realize either. The dental insurance, not just their policies, but their payout to an office hasn't changed in years.
Yes.
So most people don't realize the reason why it costs so much to even go to the dentist is that doctor needs to, cover their overhead.
Mm-hmm.
And which brings me to another question. UCR. Nobody knows what that means. Could you explain what a UCR is?
So UCR are usual and customary fees. Basically, these are the fees that are for someone that does not have any insurance. These are the fees that you would pay out of pocket. Okay. So
Mm,
they are very high. They are. But again, if you were to come into the dental office and you needed, work to have done, it's either you have insurance or you don't. So if you don't have
right,
insurance, you have to pay the cost of what it would be to have, say, a crown, a filling, a root canal, even a cleaning because you don't have any dental. But a lot of times, most dental offices have, new patient specials where you can get something or have like a discounted rate off of the UCR fee.
right, right. Okay, so I don't want to jump to this one. I'm gonna save this question to be kind of like the last one after we go through it all. All right. So my next question is: my plan says it covers 100% towards my preventative care. What does that mean? And does that mean everything?
Well, preventative care is basically exam, x-rays, and a regular prophy. I don't want to say, I'm going to say a regular cleaning because a lot of people get confused when they think just because their insurance covers for a regular cleaning, you can't allow the insurance to dictate what type of care that you need. Because you can come
Absolutely.
in and it can be that you need a deep cleaning, which is below the gum line.
Right.
Anything below the gum line is periodontally involved. Anything
Correct.
above the gum line is a polishing, which is a prophy. Now, if you have buildup and all this going on, you are not going to be a regular cleaning.
Absolutely. That will be another show because I work in the back. Well, I started in the front, but I work in the back, and that's one of the biggest arguments is when after you take the x-rays. First of all, patients don't want to take the x-ray. That's number one.
Mm-hmm.
Just know that no office is getting rich off of x-rays. Just know that.
Mm-hmm.
So, insurance is not really even paying that much towards the x-ray. So,
Exactly.
understand that. So we're not getting rich on you off of an x-ray. However, that x-ray is very, very important for us
Yes,
to
it is
diagnose you
necessary.
properly.
Yes.
We cannot give you the proper care without that x-ray. And
Hmm.
dental x-ray is not the same as going to get an MRI at the hospital. Understand
Exactly.
that. It's not generating the same radiation. So
Hmm.
that's another reason why we're doing this show is to basically educate people on what happens when they walk in the office. And
Hmm.
insurance is a big part of it. But
Yes.
getting back to that cleaning, we need to have that x-ray to determine what type of cleaning and what your insurance will cover at
Hmm.
that particular time. Because, like you said, if you have a healthy mouth, yes, you will be getting a prophy because your mouth is healthy and clean. But if you have little, I call them barnacles. That's just the best way to understand it. When you
Hmm.
take that X-ray and you see these little things sticking out on your teeth on the X-ray, we're calling them barnacles because that's the way we can explain it to the patient for them to understand. Actually, what that is tartar buildup in calculus. That's what
Yes.
it actually, that's the actual name of it. But if you have that, then that changes everything, and then you may have to pay out of the pocket, and your insurance may not. So SRP, most people hear that and they're like, "Don't give me that." Some of you need it. I mean,
Mhm.
it's usually not covered. There's a
Mhm.
few insurances that do cover it,
Mhm.
right? I mean,
Yeah.
a
Some
few.
insurance they cover for it 100%. Some of them do cover for it 100%.
Oh,
But
okay,
it is just depends on, like I said, it depends on the plan that you choose. You can get a plan that's 180, 50. You can get a plan that's 100, 160. So it just all depends on which plan you choose, especially if it's a PPO. Now HMO, you're going to have an out of pocket. You will have an out of pocket. And why it's so important when it comes down to, like, if you do need a deep cleaning, it's so important because your mouth is connected to your heart. So if
absolutely.
you have all this buildup, all this calculus, you have bleeding gums, guess what's happening? Your gums, you're bleeding, you're swallowing this. So this is going within your body. So this will cause you other issues down the line if you do not take care of it or get your cleaning and maintain your mouth. That is
Exactly,
very important.
exactly. I'm gonna jump into, we hit on the HMO and the PPO. DHMO, do you get a lot of those plans today?
A lot of people do not take the HMOs plans only because this is the thing with the DHMO plans. You have to have a referral to go to a specialist. You have to follow through with what they want you to go to, the doctors that they want you to go to. So if you had a doctor that you were going to when you were younger and you know that this doctor was a very good doctor and you want to go to that doctor, you can't go to that doctor because that doctor is not in your network. So you have
Right.
to find somebody who is in your network to go. And a lot of times when you go to specialists, they don't take the HMO. So you end up having to pay out of pocket anyways.
And it's very
Because,
expensive,
yes, very expensive because it's not covered under your plan.
and because they don't, DHMOs just really don't pay. Most offices
They
have to,
don't. They
what you
don't.
call it,
They won't.
decapitation, where that means they got
Yeah.
to
So,
sue about a
hmm
hundred people just to get paid
hmm
a few
yes.
dollars.
Yes, exactly. Exactly.
Okay,
It's a game, but it is something that is affordable for some of those people that need to get those plans. It's just sad that those are the plans that they're giving them to pick, you know.
exactly. Absolutely. So now, what about the in-office plan? What do you think about that? I mean,
Well, I
who
think
would that plan for?
that plan is for someone who can't get insurance. Well, they can get it, but they don't want to pay a lot of money, every month. So, in office plan, if an office carries that, you pay one fee and usually it's good for a year. Once you get
Mhm.
that plan, you get discounted rates on the treatment that you need, whether it be fillings, crown, extractions, if we're able to do the extractions. So you get a discounted rate. Now, some plans it's covered with the exam, the x-rays, and the cleanings. So it
Mhm.
just all depends on what office offers what, you know. Some
Okay.
offers
And
some offices have new patient specials where you come in, you pay one fee, but then when you come back again, you have to continue to pay. So it's best that if you don't plan to get an insurance through yourself or an employer, to get the in office plan that's good for a year.
okay. So, do you think that because and also we need to note that with that in-office plan, it's only good at that
Oh
office,
yes,
not
only at that office. Yes, it's never good. It's not good at another office. So you do have to keep in
right.
mind: is this the office you want to be at when you come in? Your first
That,
impression,
yeah,
So you have to know, feel comfortable. That's why I say I try to explain to every single patient and help them to understand, especially when it comes to their dental coverage, what they need and why they need it. Most
right.
of the time, if the patients understand the why, usually they get the work done and it's not a problem.
Absolutely, absolutely. I agree. So my next question here is: so what's the best plan, like, out of all of these? I mean, if you were to advise anybody, I mean, I know it's really hard to answer that question because circumstances are different for each person.
So like I state, to be honest with you, there's really not the best plan. It's you as an individual and what you got going on. If you need a lot of dental work,
Right,
I say go with the HMO, because guess what? You're gonna still have to pay, but you're gonna pay less than what you would pay if you did not have any insurance. If you're
right,
someone that you go to the dentist every 6 months, you maintain, you floss, you brush. The doctor tells you got a cavity. You don't wait until it turns into a root canal.
right.
Get a PPO plan where you get it through your employer and you pay a fee every month. You know that when you go, most of the time, yes, preventative is covered at 100%.
Right.
And when you ask those questions, if you ask those questions, missing tooth cost, waiting period, maximum, my percentages. If I could get a plan that's 100, 100, 100, okay, you will only have to pay your deductible.
Mm-hmm.
So they do have those plans, but it's up to you on what you choose to pay for each month.
Yeah, the monthly, out of your pocket monthly, because that's that. Which brings me to my next question, because I know sometimes I feel like, this is just me personally. I sometimes think that paying that monthly, whatever, $43, $50, whatever your plan requires you to pay monthly. I sometimes tell some patients, especially if they're not getting a lot of work done, take that and put it in a health savings account, and
Yeah,
that way, when it's time, it's there. It's building money for you, so it's like an investment account, and you use it for not just dental, but whatever medical situation that comes up, you can
like a
use it.
flex
Like,
account, baby.
exactly, which a lot of people don't know about the flex cards either. That's usually something that you get with an employer, but you have a lot of people who are self-employed, you know,
Mhm,
and they don't have, kind of like myself. I don't have a company or whatever that offers you any benefits,
mhm,
so therefore you have to go buy your own.
mhm, mhm.
So that's one of the things I tell a lot of patients when I'm like, you know what? Sometimes it's not worth it. I mean, if you're getting your cleanings, get the in-office plan, get your cleanings and whatever. But for anything else, just go with that health savings account. Let it, invest that money into you.
Mhm.
Save
Mhm.
that 43 or 53 or $100 that you're paying monthly for this, benefit. But if you have a big family, that's
There you go. That's where you run into that situation, and that's why I say, like, usually kids, if you start them out at a young age, going and taking them to the dentist and getting them cleanings and all that, you most likely won't have to worry. Now, kids will get cavities, but if you're taking them to the dentist where the dentist can catch it and take care of it before it gets worse, then you don't have to worry about that. So then that's where I would say, as a family, I would say I would get an
mhm,
HMO,
right.
because most of the time kids, they don't, it's everything is usually 100%.
Mm,
Everything is usually 100%. So you go, even for the child to go to a pediatric dentist, it's usually covered. Now they do have out of pockets. It depends on what they need to have done. You
right.
know, so it,
Right.
it just all depends on what the insurance covers, and then also the age limit. When it gets to a certain age, a child gets 8 years old, or Cigna, I think the age limit, I think it's 8. After that, they
Mhm.
have to go to a general dentist, and most general dentists, guess what? They don't want to see the kids because they
Yeah.
are not used to treating children that small. So that's why they have to go to the pediatrics. And then if the insurance is out of network or if it's not covered, then that's when the parents have to pay.
I
Unfortunately, that's what it is.
That's the first time I heard that, though. I didn't realize that eight. I mean,
They have age limits.
again, with me as a working the way I do as a contractor, I work at pedo, I work at adults, I do surgery, so I'm all over the place. But I didn't realize that because I've been in some pedo offices where the kids are still 15 and 16, and now they're sad that they have to move on and
Yeah.
find them a general dentist.
Now, a lot of times, most of those kids that are that age, they have a PPO insurance. So
Mm.
because they have a PPO insurance, there's not an age limit.
Oh, okay. See, that's good to know. Now I'm going to ask for myself. No, I'm going to ask for people because I get this. I get this question too. So, what's the best insurance company? I mean, you would think, and I'm not plugging anybody, but and I really
I
maybe I
mean,
probably
I'm
shouldn't
gonna
wait.
say
Like,
this. Yeah, a lot of the insurance company have changed drastically. So
yes,
I'm gonna say, back in the days, okay,
and
MetLife
that's
used
when
to
I did
be,
it back in the day.
yeah,
Delta Dental,
that
MetLife,
yes, MetLife, Delta Dental, even Emeritus, was pretty good. Cigna PPO, United Concordia,
yes,
so those are the PPO insurances that most likely are pretty good, and they pretty much cover what they're supposed to cover. But at the same time too, like, we as clinicians or doctors, we have to do what we're supposed to do to make sure the patients do get their coverage. We have to make sure
right,
we take the correct x-rays. That's why x-rays are so important. We have to make sure
yes,
if we need to do charting, that is done. All things go hand in hand with each other when it comes to making sure we take care of the patient and then get the patient's coverage taken care of.
right, right. Well, thank you. I think this has been informative.
Yeah.
And I appreciate all your knowledge. Let me see if there's anything because I had like a bunch of questions, but I done bounced all over the place. I might have to bring you back again and go over some more things. Let me see if there's something I missed here. Let me see. Let me see. What's the deal with deductibles? Do I pay? Yeah, I got that one. And how does my out of pocket? Let's see. I think I got that. And we went over the way. We went over the annual maximums. We went over that. Why does my insurance cover certain things like implants or whitening? Yeah, that's a good one.
Okay.
Get that one a
So,
lot.
yeah, for sure. So, when it comes to implants, some insurance companies do cover for implants. But again, that is a question that you need to ask when you get your plan. Does this plan cover implants? They will tell you yes or no. So, some insurances, they don't cover it, just like whitening, because it is considered cosmetic.
Right.
That is like the upgrade. Like, you want to get plastic surgery, that's what they consider as an implant. Even though a lot of times some people, they really do need implants. They don't need to get, a bridge to mess up other teeth, or
Exactly.
a
Exactly.
partial to wear to take in and out, which is uncomfortable. Like,
Exactly.
implants, I think, is the best way to go
It
if you
is.
can get it done. It is the best way to go. It lasts long. You can clean your mouth. You don't have to worry about it being decayed, because guess
Absolutely.
what? You have an implant and it's the best of the
Absolutely.
best.
I am an advocate for implants, but here's the thing. It just makes me crazy how the insurance companies don't get it. Because, like you said earlier, the mouth is a portal to your body. So if your mouth is not clean and healthy, the rest of your body is not. But see, you need proper chewing surfaces as well in order to
Exactly.
eat properly. So if I can't chew my food properly because I have no teeth in the back, which is our chewing surface, then I'm not digesting my food properly. So now I'm
Mhm.
going to end up with other issues in my body,
Exactly.
indigestion, acid reflux, all of
Yes.
these things. Just certain things because you're not breaking down the food. Your body got to work harder to break
Mhm.
down the food in order for it to do what it needs to do. And
Exactly.
and before you know it, you got gastro problems. Your stomach is messed up.
Hmm.
All because they couldn't chew. So insurance company, if you're listening, get with the program, okay? Get with the
Yeah.
program. People
Yeah.
ain't out here just trying to get implants in their head because they don't need them.
Hmm.
That's not cosmetic. That's medically
Yes.
necessary, as far as I'm
Yes.
concerned. If you got a problem with it, call me. That's what I'm just.
Yes.
I'm just saying. I'm just saying. But that's it. So I think we hit on a lot today. I'm
Okay.
not going to take up much more of your time. I think this is wonderful and informative. I have one more part to this.
Okay.
This was like a little series that I was trying to do. The first
Okay.
part of this was just explaining the DHMOs. But
Hmm.
you mentioned something earlier too, and indemnity. What was that?
Indemnity. Indemnity.
Indemnity. What
Yeah.
is that one? That's a new one for
So
me.
it's like basically they can go anywhere. The doctor, no matter what, it's gonna be like they're gonna pay the doctor's fees. So you know how sometimes when you have a PPO, we have to go by that contracted rate. An
Right.
indemnity plan, they can go, but they're gonna basically max out right away. So say
Mm,
if it's 100% and they need a root canal and they got a $1,500 maximum, and we charge $1,500 for the root canal, guess what? They're gonna have to pay for the crown and all that out of pocket because they're maxed out because the insurance is paying 100% or whatever the percentage is of our fee.
I was getting ready to end, but see, now you brought up something else. I think it's important to bring it up. That's why I said this probably have to be a three-part series because I didn't want it to be so long. But I think it's very important for them to understand. Going back to the root canal and also same thing with implants. I know MetLife was one of the first one insurance companies that was paying for part of the implants in the beginning. They would pay for the abutment. Most people don't realize there's three parts to an implant. You have the
Hmm.
abutment, and then you have your the implant itself, the abutment, and then the crown. So that's like
Yeah.
three different parts of the crown.
Hmm.
And
So you
sometimes
have
they
the
would
they
right.
have
So
the ones the
sometimes they
implant
would
that
pay
go in. Yeah.
right, and they'll pay for one part, but down not the crown. So now you got an implant in your head, but you don't have a crown, because you didn't want to go pay for that.
Well, that's now if the insurance says on their breakdown that they cover for implants, then they should cover for that crown too. If they're not
Mm,
covering, if they're going to cover for the implant and they say that they have implant coverage, they should cover for their implant. Now, some insurance companies have stipulations
right.
with
Okay.
the implant, like say for instance, if you want an implant right here, but then you don't have no teeth in the back. Why are we going to pay for this implant? Because you don't have sustainable teeth to say, okay, you have this many teeth in this area, so that way you can get that implant to just replace it. That's where it comes at when it comes to that.
Mm, yeah. So they just find a way to just get out of it.
Exactly.
So now let's with the root canal. Most people don't. I mean, back in the day, people didn't realize that you do a root canal that you had to get a crown because once you get that root canal, your tooth will get brittle at some point and it will break. That temporary will fail and it will break. So you have to get a crown to cover it.
And a
So a
buildup.
lot of it got in a
Mhm.
buildup. Yes, that's very important to have because that buildup kind of fills the inside of that tooth after we drilled it out, and it will build it back up and make it strong again. And can you add your input on that information with
Yeah.
as far as
So
the insurance
the,
portion?
what I always tell the patients, usually, like I say, if you end up and if you have a PPO, you're gonna max out with that root canal and that crown and that build up. I always tell patients so that they can understand. If you ever have a root canal, you have to understand your tooth is dead. So you have to think
Mm,
of it that way. The tooth is dead now. It has no
right.
nerve. So because the tooth is dead, you have to protect it. So yeah, you have the root canal, you think you out of pain, you still have to come back, do the buildup and the crown or the post. Sometimes they have to do
So,
prefab, post, or
right.
whatever. It just depends on what that doctor feels that tooth needs after it has the root canal. So it goes hand
Okay.
in hand always together.
Absolutely. So thank you for explaining that. And at this point, I will end the show because we're at 34.20 minutes. And I said
Okay.
I'm going to keep this short. So, but you and I could probably talk all day about insurance because
Yeah.
we live it every day. We're doing it every day. And I mean, it is an exciting and really, it has grown massively. This field has grown.
It
And
has. It's very important, and I feel like one thing that I want to people to understand, you cannot allow the insurance company to dictate what you need. That
that
is
part,
one of the things that I it bothers me because I feel that a lot of times people they allow the insurance company to tell them what they can have done when that's not what they need.
right.
So they need to understand that. Okay.
Right. I agree with you because I mean, I'm in the back and I sit there and I listen to them. Do my insurance cover it? But do my insurance cover it? I'm like, it doesn't matter. This is what you need for you to, to be well again. Like,
Hmm.
don't say because the insurance is not covering it, you're not going to do it, because that's just like, again, would you go to a heart surgeon and tell him, the insurance ain't
Hello.
going to cover it, so don't replace my heart, don't fix it? No,
Yeah.
you're going to be like, oh my God, how are we going to get this money to fix my heart?
Exactly,
That's
exactly. That's why I say
you,
it goes back to them understanding the why and trusting the doctor that they know that that's what they need. You know?
exactly, exactly. So, Miss CC, again, thank you. I appreciate your time
No
and
problem.
all your expertise. And you can jump on anytime.
For sure.
And, and is there any last everlasting words you want to, just some more wisdom you want to put out there before your last words?
My last words, I guess, just do your research, do your homework when you're choosing to get an insurance, whether it be a HMO, a DHMO, a PPO, or an indemnity. Ask the important questions that you need to ask so that when you choose, you're not looking like blinded when you go to the dental office and they tell you, oh, you got to wait 6 months, or you have a missing tooth clause, so we're not going to cover for it. So those are the important questions that you must ask when you get that plan. Yeah.
That's right. Y'all heard it from Miss CC. And she
Yes.
knows what she's talking about.
Yes.
25 years in the industry.
Yes.
Yes. So again, thank you, and I'm gonna be calling on you some more. This was very
Okay.
great. This was really nice. I enjoyed it. I enjoyed
Awesome.
you. I enjoyed the information, and I hope those everybody out there who paid attention and watched this enjoy it. But if you did like what you heard today, hit that subscribe button and come back for the next episode. We got one more part to this. This is a
All
three-part
right.
series. Bye bye.
Bye.
There we go. All right, so I'm your host, Yvette. You've just been watching the Dental Deep Dive. So again, chime in on the next episode. I'll bring you the next one, I guess, in another week or so, because I'm trying to do these every Monday, trying to spit out a new one. So thank you. Continue watching.